Millions of people around the world suffer from food allergies or intolerances, and sometimes it can be difficult to know which is which. So in this video, we'll look at the difference between the two and explore some of the most common types of food allergies. The foods that cause allergic reactions are known as allergens, and these can cause a true allergy, which is an immune system reaction to a particular protein in the food, or a food intolerance, which is usually a non-immune reaction, and may be related to a food or an additive that you're sensitive to. Some of the most common allergens include nuts and nut products such as almonds, walnuts, and cashews, dairy products including milk, cheese, and yogurt, gluten found in wheat, barley, and rye, and also soy and shellfish like shrimp, crab, and lobster. But there are many other foods that can trigger allergic reactions too. Some of these are fruits such as melons, bananas, and avocados, and vegetables like tomatoes, potatoes, and spinach. Other common allergens include eggs, beef, pork, chicken, fish, sesame seeds, peas, beans, lentils, corn, and yeast. And less commonly, allergies to additives like food dyes and preservatives can occur. Symptoms of a food allergy can range from mild to life-threatening, and it can affect the skin, the respiratory system, the digestive system, and the circulatory system. Skin problems associated with food allergies include eczema, hives, and swelling of the lips, mouth, or throat. In the respiratory system, wheezing, coughing, sneezing, and runny nose are possible, as well as asthma and, in severe cases, anaphylaxis. Food allergies can also cause nausea, vomiting, diarrhea, stomach pain, and bloating. And, as mentioned before, anaphylaxis, which is a severe allergic reaction that can be life-threatening, can occur. If you think you might have a food allergy or intolerance, it's important to seek a diagnosis from your healthcare professional because many symptoms overlap between the two. For example, both can cause abdominal pain, nausea, and vomiting, and also because some symptoms of an allergic reaction can mimic other conditions. For example, hives can be caused by reaction to a food, or they can be a sign of an underlying medical condition. So it's always best to get checked out. Allergies and intolerances can be diagnosed through a combination of physical examination, reviewing your medical history, and, if needed, allergy testing. Your doctor will ask about the type of symptoms you've been experiencing, when they started, and what foods you think might be causing them. They may also want to know if you have a family history of allergies and if you've had any recent illnesses or infections. If your doctor suspects that you might have a food allergy, they may refer you to a specialist for allergy testing. This can help identify the specific food or foods that are causing your symptoms and can provide more information about the type of allergic reaction that you're having. There are different types of tests available, including skin prick tests where small amounts of the allergen are placed on your skin and then lightly pricked so that it can absorb into the outer layer. Or a blood test, where a sample of your blood is taken and tested for the presence of specific antibodies called IgEs, which are produced by the body in response to an allergic reaction. Once a food allergy has been diagnosed, the best way to avoid the allergic reaction is to completely remove the allergen from your diet. This means being careful when reading food labels because many processed foods contain hidden sources of the allergen. Also, it's important to avoid cross-contamination when preparing and eating food. This can happen when an allergen comes into contact with another food during processing, or when you're cooking or eating. For example, if you're making a sandwich with peanut butter, make sure to clean the knife and the bread before making a sandwich with another food that contains nuts. It's also important to be aware of the symptoms of anaphylaxis, because if they do occur, treatment needs to start straight away. The main treatment for anaphylaxis is an injection of epinephrine, which can help to relieve the symptoms while you seek medical attention. It's also a good idea to carry an ID card or wear a bracelet that lets people know that you have a food allergy and what you're allergic to. This can be especially important if you travel because it can help ensure that you get the right treatment if you have a reaction. Now let's take a closer look at some of the most common food allergies. The first is a nut allergy, which is an allergic reaction to proteins found in nuts like almonds, walnuts, cashews, hazelnuts, and pistachios. People with a nut allergy may also be allergic to other tree nuts or even peanuts. Symptoms can range from mild, like itchy skin or hives, to severe, like anaphylaxis. If you have a nut allergy, it's important to avoid all nuts and nut products and to read food labels carefully since nuts are often used in processed foods. You should also be aware of the symptoms of anaphylaxis and carry an epinephrine auto-injector if your doctor recommends it. Next is a dairy allergy, which is an allergic reaction to proteins found in milk and other dairy products like cheese and yogurt. Lactose intolerance is a common dairy-related problem, but it's not a true allergy. People with lactose intolerance have difficulty digesting lactose, which is a sugar found in milk, because their bodies don't make enough of an enzyme called lactase that's needed to break down this sugar. This can cause bloating, gas, and diarrhea after drinking milk or consuming dairy products. However, there are also many people who are allergic to milk proteins, including casein and whey. Symptoms of a dairy allergy can include hives, itching, swelling of the lips or tongue, and even anaphylaxis. Those with a dairy allergy must avoid all dairy products and also be careful when eating processed foods since dairy products are often used as ingredients. The next food allergy we'll talk about is a wheat allergy. Wheat is a grain that's used to make flour, which is used in many processed foods. Wheat allergy is an allergic reaction to proteins found in wheat flour, and it can cause symptoms like hives, itching, swelling, and in severe cases, anaphylaxis. People with a wheat allergy need to avoid all wheat products and read food labels carefully since wheat flour is used in many processed foods. Wheat allergy should not be confused with celiac disease or gluten sensitivity. These conditions are not true food allergies, but they can cause similar symptoms. Celiac disease is an autoimmune disorder where consuming gluten triggers an immune response that damages the small intestine, and over time this can lead to malnutrition. Gluten sensitivity, or non-celiac gluten sensitivity, can cause symptoms like bloating, gas, and diarrhea after eating gluten-containing foods, but without damaging the small intestine. Currently, there is no cure for celiac disease or gluten sensitivity, but avoiding gluten can help improve symptoms. A low FODMAP diet has been shown to be effective at reducing symptoms in those with IBS, and it restricts certain carbohydrates that are poorly absorbed in the gut, like FODMAPs, which are fermentable. Oligosaccharides, disaccharides, monosaccharides, and polyols. Next up is an egg allergy. Egg allergy is an allergic reaction to proteins found in eggs, and it can cause symptoms like hives, itching, swelling, and anaphylaxis. People with an egg allergy need to avoid eating eggs and also be careful when eating processed foods since eggs are used as ingredients. Symptoms of an egg allergy can be mild or severe, and they can start shortly after eating eggs. Another one to mention is a shellfish allergy, which is an allergic reaction to proteins found in shellfish like shrimp, crab, and lobster. Shellfish allergies are usually diagnosed in adulthood, and symptoms can range from mild, like itchy skin, or hives, to severe, like anaphylaxis. People with a shellfish allergy need to avoid eating shellfish and also be careful when eating processed foods since shellfish are often used as ingredients. Shellfish allergies are usually lifelong and there's no cure. However, over time, symptoms may become less severe. And finally, we have a soy allergy, which is an allergic reaction to proteins found in soybeans. Soy allergy symptoms can range from mild, like itchy skin, or hives, to severe, like anaphylaxis. People with a soy allergy need to avoid eating soy and also be careful when eating processed foods since soy is often used as an ingredient. Soy allergies are usually lifelong and there's currently no cure. However, over time, symptoms may become less severe. There are many other types of food allergies and intolerances, but we haven't been able to cover them all in this video. If you would like to learn more about a specific type of food allergy or intolerance, please let us know in the comments below, and we'll do our best to make a video about it. Thanks for watching, and see you next time.